Hi, this is Deborah Bowden, and with Madison Boer, we are doing a presentation on the measles today. Etiology of the measles. This is also known as rubiola, which means red measles, is caused by the morbillivirus. This is classified as a macular-papular rash disease. Prior to the vaccine, measles used to kill over 6 million people every year. However, there's currently a trend of many parents who are opting out of vaccinating their children. Most of this is due to an unfounded fear that links the vaccine to autism. So, as a consequence, we're seeing um, an insurge or a rise of the measles infection in children more than we used to. This morbillivirus is a single-stranded negative sense enveloped RNA virus. It invades monocytes, which is a type of white blood cell. The measles virus induces the cell membranes of the adjacent host cells to fuse into large syncytials, which is giant cells, and makes them multinucleated. They replicate in the lymphatic tissues, and then they are carried in the bloodstream to the skin, which is the condition that is called viremia, and that's how the virus gets to the skin and causes the rash.
Hi, my name is Madison Boer. This presentation is going to be about measles. The first section that we're going to talk about is the reservoir for measles. So, a reservoir of infection is any person, animal, plant, soil, or substance in which an infected agent normally lives and multiplies. The reservoir typically harbors the infectious agent without injury to itself and serves as a source from which other individuals can be infected. So with measles, the only reservoir is humans. Humans are the only mammal that can attract the measles. No dogs or cats or anything like that.
I'm going to be talking to you today about the signs and symptoms of measles, and from there we're going to move on to transmission and how it's spread. And it's a very contagious disease, and that's what we're going to do. Okay, all right, thanks. We'll go to that point. These are the symptoms here for the measles, and the incubation period is 10 to 14 days. You start initially with a mild to moderate fever. You have a persistent dry cough, a runny nose, inflamed red eyes, a sore throat, and a headache, and start off looking pretty miserable there. The signs are after the first 2 to 3 days with the mild fever, you suddenly spike a high fever, 104 and above. Um, and then tiny white spots kind of start appearing in the mouth. These are called the Koplik spots. That's these little things here. It's red with these little white heads on them there. That's the Koplik spots. And then, of course, you come out with the classic, the rash, the red, the red raised spots, the skin rash. Some of them can run together, so they kind of look like your skin is getting a blotchy or splotchy appearance. The rash appears first on the face and the head, and then can spread to the trunk, and then to the extremities. And you're looking like you're a pretty sick little kid there. It looks very miserable. Transmission. So, how can you get this, and how is it spread? Well, it's a very highly contagious virus. 90% of those exposed who are not immune will become infected. It is carried in the mucus of the nose and the throat of the infected person. And it is spread by coughing and sneezing via the respiratory droplets. So you can imagine if you're coughing and sneezing, it is just put out there into the air. And if you are not immune and you just walking in the room, chances are you're going to breathe that in. And here's the eye opener here. The virus can remain alive up to 2 hours in the airspace. I found that to be very shocking. And it can be spread during the incubation period, which, like I said, was the 10 days to 10 to 14 days before you even start, before you even have that initial fever. So you don't even know you're sick, through the 4 days after the rash first erupts. So um, you're spreading it even before you even know you have it. And I think that's why it can spread so quickly.
The next section we're going to be discussing is the treatment as well as prevention and control for measles and what would be required if one were to contract measles, as well as what to do before we receive measles. So, for the treatment of measles, there's no specific antiviral treatment. What is suggested to be done is to take care of those infections, such as ear infections. Make sure that you get those antibiotics so that that doesn't get worse. You should also make sure that the person suffering from measles is replacing their fluids that are lost from vomiting, as well as diarrhea, and making sure that they have proper nutrition so that there's no more severe complications. Children in developing countries with measles should also make sure that they get 2 doses of vitamin A supplements. So there's a post-exposure vaccine or vaccination. So after you've already been exposed, somebody who's not been immunized, especially infants, can be given that vaccine within 20 or 72 hours of exposure. And this will protect against that measles disease. If it still develops, then the illness will probably have milder symptoms and last for a shorter amount of time. There's also an option to do the immune serum globulin. This would be for pregnant women and infants who have, as well as probably the elderly, those who have a weakened immune system that are exposed to the virus. They can get these proteins or antibodies injected, and it's called that immune serum globulin. This is from the Mayo Clinic, and it's when it's given within 6 days of exposure, they can prevent measles, and they can also make the symptoms less severe. For prevention and control, isolation is the first step for someone who doesn't have measles. Measles is highly contagious, and it's about 4 days before to 4 days after that rash breaks out that people are the most contagious. People with measles shouldn't go back to their activities, such as school or sports or things like that, where they're interacting with other people, especially these 4 days before and 4 after. It could be also necessary to keep the non-immunized people, such as their siblings or anybody that lives in the home with them, to stay away from that infected person because measles is so contagious. We need to make sure that we vaccinate. Someone who is at risk for getting the measles and hasn't been fully vaccinated must get the vaccine as soon as possible. They need to be vaccinated as well as any infant that's over 6 months old. We also want to promote the herd immunity. So since the measles vaccine has happened, it's been pretty much eliminated. Herd immunity basically means that if everyone around you has kind of been vaccinated, they're not likely to get it, so you're also not likely to get it. So if everyone else has, not everyone's been vaccinated, it's not very likely that you will, need that vaccine. However, the vaccine is still highly suggested. The vaccine that is given is called MMR. This is the measles, mumps, and rubella vaccine. And this comes from the Enders Edmondson strain, and it's given in 2 doses. The first dose would be given by the child's first birthday, and the second dose would be given between 15 months and 12 years. So this MMR vaccine is called a live attenuated viral vaccine, an LAV vaccine. And basically this type of vaccine is a weakened version of the virus. So they take the virus and they basically dilute it, and then they'll inject it into the patients, and their bodies will be able to fight that disease, and they won't hopefully get measles.
Okay, so now I just wanted to go over some of the additional information that we have for you um, about measles. There's some interesting statistics to talk about, especially in regards to uh, the incidence of infection and how it can, the sequelae and the and the other things that can happen as a result of having a measles infections and the other infections that can happen after you have that. And so I'm going to show you that slide. And then I think that'll be the end of our presentation. We just have a few reference slides after that. Okay, here it is. Thanks very much, guys. There's a large number of people who end up with secondary bacterial infections when they have the measles, and they end up with things like laryngitis, ear and sinus infections. About 1 in 4 people in the US who get measles will be hospitalized. 1 in 1,000 will develop measles, progressing to pneumonia or encephalitis with brain damage, maybe even epilepsy for some. But the most serious complication, which is rare, but it could happen, is this subacute sclerosing panencephalitis, which can cause profound intellectual and neurological impairment and eventually coma and death. That's the most rarest of the conditions, but it does happen. Um, just some references here where we got some of our information. And that's what we have so far. All right. Thanks very much.